Welcome to Health in Retirement. Each week, we'll discuss health challenges facing retirees and various ways to address them. We focus on more than just physical health. We look at financial health, mental and emotional health, as well as spiritual health. With your hosts, Rick and Rebecca, this is Health in Retirement.
Hi, and welcome into Health in Retirement. I'm Rick Everett.
And I'm Rebecca Jones.
And we're here to provide you with some entertainment for the next half hour or so on health in retirement. And Rebecca, when we talk about health in retirement, we're not just talking about the physical aspects.
No, which is very important. But as we all know, retirement, you can't retire unless you're able to financially. So, I mean, it's imperative that we take a look at that as well.
So we'll be looking at some of the financial aspects. And with us as our guest in this segment is Matt Goolsby. Matt is an investment advisor with Market Advisory Group.
Hey, guys. Thanks for having
welcome,
me.
Matt.
Thank you.
Welcome in. So, Matt, having worked with people planning retirement for a long, long time, would it be safe to say that people with a plan in place are generally more calm or less stressed than people without a plan?
Most notably, yes, because when you go into retirement, there's important times to consider, not just when you decide to leave the workforce, but things leading up to that. And some people can fly by the seat of their pants. Some people need to know a little bit more detail. Some people want to plan things out way in advance. So it's everyone's preference, but there's a peace of mind that comes with what happens, where does the income come from, how does it get taxed, when does my healthcare turn on for Medicare, when might I run out of money? That's also a big concern. There's been countless studies on people are more afraid of running out of money in retirement than they are of actually death. So that tells me that there probably is a great deal of people out there that do not have a plan or haven't considered a plan because, you know, it as Americans, it's not uncommon for people to live paycheck to paycheck. And in retirement, that's a little bit more risky to do.
Exactly. I think security is the number one thing that we're all looking for in our life. And if you're able to have a good plan or at least a plan at all. I mean, even I'm going in 38, coming up on 40, and I'm starting to think, I gotta, start thinking about these things even at this age.
It's never too early to plan. And of course, as you near retirement, the plan can change. And the plan is never a set it and forget it plan. You often have to pivot is a big word that's thrown around now, but modify and adjust the sails for when economic conditions change, the economy changes, the world political economic system changes, when there's a pandemic, all the things that can be thrown at you. Most people would love to retire in a bull market when the economy is doing well, when the market's going up. But the fact is, most people can't control what the economy is doing when they retire. And do you want to retire in a strong economy or a poor economy? And the fact is, you're not in control of that. So the more planned and prepared you can be, the better it is for your overall well-being, let alone your financial health.
So the mental health aspect of having a plan in place does, in fact, alleviate some of that stress, some of that fear of the unknown.
It does so much, and there's more to it than just the investment side. Take Social Security, for example. Yes, you can start turning it on as early as age 62, but widows or survivors benefits can start as early as age 60, and a lot of people don't know that. We'll teach some Social Security classes around the metros, and it never fails. A couple times a year, I run into a couple of gals, or predominantly women, that have been widowed, and they didn't have any idea they could have been collecting some kind of benefit. Then you take taxation. Taxation is often an afterthought. People go file their taxes, and they say, you know what? I didn't owe anything last year. I probably shouldn't owe anything this year. But that's not how taxes work. Your income can change every year. The tax laws can change every year.
Exactly.
And then taxation on Social Security is treated differently than ordinary income. So there's so many other components to it besides just the investments.
Exactly. I mean, I feel like I would need to go to a whole class myself just to even get a crumb of the knowledge to feel really, to ease that anxiety that I feel going into retirement. And that's all that we want is safety and security, to ease the stress, to help with our mental health, and to enjoy this time of our life, really.
We'll often refer to it as the SWAN plan. SWAN standing for sleep well at night. And you need a plan to be, more at ease and know what's going on. And then prepared for when the uncertainty pops up, because life is always uncertain, whether it's losing a spouse early on in retirement, whether it's having a health incident that costs you a lot of money in retirement, whether it's the world political, like I said, scenario, good or bad, and the economic scenarios, good or bad. So you need to have those plans that you can adjust and compensate for things that are not in your control.
I know a lot of times when you're meeting with people, that little counselor hat comes on. And so I wanted to ask you, when you're doing counseling, if you will, in many capacities, what would you say is one of a person's largest or most common concerns about retirement that has absolutely nothing to do with the financial aspects?
Oftentimes it's just being on the same page if you're in a relationship or a couple or a spouse. And that sometimes, like you said, I'm a counselor, or we can be counselors in those positions. Some I'm more qualified to counsel in than others. I'm certainly not a marriage counselor, but you want to be on the same page because, like I mentioned earlier, if a spouse predeceases the other spouse early on in retirement, what can happen there to the surviving spouse if they've not been looped into the investments, if they've not been looped into where the income's going to come from, if they've not been looped into who can help them navigate all these different things that they've never had to take on those roles. And we come into play there, but oftentimes we think we're going to live forever until the doctor comes in and tells us something, where it's like, no, we're not.
Matt Goolsby of Market Advisory Group. Matt, thanks for sharing some time with us in this segment. And when we come back in our next segment of Health in Retirement, we're going to be visiting with co-host Rebecca Jones.
Yes.
And we're going to find out a little bit about what makes her tick. And we'll do that right after this. Welcome in to Health in Retirement. I'm Rick Everett along with
Rebecca Jones.
And Rebecca, when we started to plan Health in Retirement as a television show, or as a podcast and radio show, I should say, we wanted to have somebody that would be open to looking at the holistic views that come to mind when we're talking about health in retirement, not just the physical aspects. But Rebecca Jones is one who actually practices what she preaches when it comes to the holistic approach to health. And Rebecca, if you could share with us a little bit about your background and what interested you in health in retirement.
Yes, thank you, Rick. I would like to say, I think it all started about 10 years ago. I was really sick and just going to the doctors, for about 5 years. And they couldn't really figure out what was wrong with me. And I had to really be my own advocate. And I think that's what we all need to do, is to take our health in our own hands. And after doing my own research and really just taking my health in my hands, I decided to go the holistic approach and to kind of go outside a little bit into what they don't really teach you in school, beyond, the food pyramid, beyond what, the stereotypical things that doctors are going to tell you, here, take a pill to, cover up a symptom, but not fix the actual problem.
So what were some of the holistic approaches that you explored?
The first one was nutrition. I mean, I did get into the fitness industry. I was about 50 pounds overweight. And after just educating myself on fitness and nutrition, I was able to lose the weight and get healthy and understand the actual benefits of food. If you have a car and it takes, gasoline, but then you put diesel in it, and then you're going to complain about how it runs, that doesn't really make sense. So, I think first and foremost, nutrition is key.
Now, it's my understanding, in addition to believing in and practicing a holistic approach to health in your life, you also are gifted in the area of massage therapy as well as Reiki. And I've never really understood what Reiki is.
Yeah.
What exactly is Reiki, and what are the benefits of it?
Yes. We are all, in essence, we are energy. Down to, the atom, we are energy. And Reiki, in essence, is energy work. So the body has an energy field of about 3 feet. And so you can work with someone's energy field to help heal and guide them through, a healing process of whatever our bodies. We don't have to tell our body, okay, heart beat, okay, stomach, do this. Subconsciously, our bodies are intelligent.
Involuntary.
Exactly. It knows. So our energy knows what to do to heal your energy.
So through Reiki, you can almost manipulate a person's energy into a healing faction?
Exactly.
Very
Yes,
cool.
yes. And massage goes along with that. Really, after I got down to the nutrition and the exercise and the muscle and the actual body, and then I wanted to go into I want to be able to feel well and feel physically capable of, having a healthy life, be able to just move, go up and down the stairs without,
Rebecca, also there's other holistic avenues that you've also explored, and I was wondering if you could share some of those with us.
Yes, I have recently delved into the emotion code and how that kind of goes along with the mental aspect of our health, and how if a lot of us, especially unfortunately for men, we're told not to, be a man, don't feel. And when you're not allowed to feel, those emotions get stuck in the body and then will cause physical ailments, because it's all energy. Emotion is emotion, energy in motion.
Rebecca Jones, proud to call you the co-host of Health in Retirement, and we do explore the holistic approach to health in retirement. As Rebecca was saying, not just physical, not just emotional or mental, but nutrition, exercise, and activity. Continuing to search for and maintain and have a sense of purpose as you're approaching retirement. We'll be back and take a look at Medicare right after this. Hi, and welcome back into Health in Retirement. I'm Rick Everett.
And I'm Rebecca Jones.
And we're joined in this segment by Cory Hiebert. Cory is with Market Medicare Advisors, and Medicare, of course, a key component as far as maintaining health in retirement. And Rebecca, you were sharing a question with me before we came on the air.
Absolutely. I mean, they don't necessarily teach about Medicare in school. So, I mean, which is something that, I mean, as we come up on age, and what age should we really start thinking about Medicare?
Yeah, that's a great question. And the answer is that can totally depend on your situation. So Medicare gives us 2 opportunities to go ahead and decide to enroll in parts A and B. Your first opportunity is what we call the IEP, or your initial enrollment period. The IEP lasts for 3 months before the month you turn 65, the month you turn 65, and 3 months after. That's where we can go in and we can start Medicare A and B with 0 questions asked. We would go to myssa.gov or call into the local Social Security office, and we can sign up that way. But for some people, we don't have to start Medicare when we turn 65. For instance, if we're going to continue to work and have that group plan with our employer, we don't have to start Medicare, and we can postpone those benefits for as long as we need to. But the second that we decide that we are done working and we are ready for retirement, that is when we need to use our SEP, or our special enrollment period, which is an 8-month window that we can start Medicare A and B. Now, if we use that SEP, there is some extra paperwork that we have to fill out. And I say, of course, everything is really easy with Medicare, but those forms are buried pretty deep on the Social Security website. We got tons of them here in office, and I really like helping people out with that.
Now, Medicare is part of the Social Security Administration?
Yeah, so that is a little bit of a confusing situation that we get. So your Social Security benefits are tied in with your Medicare benefits. In fact, for Part A, we don't pay a premium, but Part B, we do. Most people don't pay that premium outright. It's actually typically withheld from a Social Security check. And all those benefits are ran through the Social Security office. So even though we are going to ssa.gov, it is for your Medicare.
So I have a question. So if someone is approaching retirement but they have some pre-existing conditions and their health is maybe not, where they would want it to be, what do you suggest they do in those cases?
Yeah, so Medicare is really cool. Since everybody needs it when they turn 65, there is the assumption that, of course, you're going to have some people with an underlying condition. Will they be penalized for joining Medicare with an underlying condition? Absolutely not. Whenever you very first start Medicare, you do have that once in a lifetime, what we call a guaranteed issue period. And in that guaranteed issue period, they can't rate you up for any conditions aside from smoking. If we are a smoker, we can be rated up. But if we have a heart condition, if we've had a heart attack, we've had a stroke, we've had anything, they won't charge you more because of that. And that is why it is important when you first start Medicare that you understand all of the options you have, because that first decision you make could be a very, very important one.
Now, can a person draw Social Security without being on Medicare?
Yeah, absolutely, and vice versa. So you can start Social Security and then delay your Medicare benefits, or even if some people start drawing Social Security early, before 65, you can absolutely do that without starting Medicare. And on the other hand, people that want to delay their Social Security, you can still going to ssa.gov, start your Medicare benefit, and not do anything with Social Security.
Where should retirees go if they're wanting to start Medicare benefits?
Yeah, so I was saying earlier, myssa.gov. It is very important that we hop on there and we are knowing what is on that site. There's a lot of very good information. It can be a little bit difficult to find those Medicare sections, and I'm more than happy to walk anybody through that. As well as with government offices starting to open back up after the pandemic, we can go straight to our local Social Security office or give them a phone call. But if you need help with that online assistance, we're always here to help you and walk you through that process.
Yeah, exactly. I think even for me, I know a lot of my friends too, it can be overwhelming to try to understand all of the ins and outs and, like you said, find the right forms to fit me or, whatever. So I think it's just invaluable to have someone on your side that has your best interest at heart. And I feel like you're one of those people that is on their team and on their side and wants the best for them.
Yeah, absolutely. And I am a younger guy. I'm supposed to be the tech savvy generation, but I'll shamelessly admit I spent probably 45 minutes digging through that website, trying to find the exact right paper that we needed. And if it took me 45 minutes, who's knowing how much longer it will take anybody else.
If somebody is planning on retiring at age 65 and beginning Medicare at age 65, how far in advance of that time should they be looking at, exploring, considering options?
Yeah, absolutely. So like I said earlier, your initial enrollment period, you can start or enroll into Medicare up to 3 months before you turn 65. So in that 3-month period, that's where we can actually start making decisions about your Medicare. But that 3 months can go by very quick. I tell people it's typically good to have a game plan, or at least understand what options you have before we're in that 3-month period. So I typically say about 6 months out, it's very good to get a meeting, a one-on-one with an advisor, where you can sit down and fully get the full scope.
We've got about a minute left, Cory, and I wanted to use part of that time to ask you, what important dates and timelines should be on individuals' minds as they're entering into the Medicare scene?
Yeah, absolutely. The biggest ones, definitely like we've discussed a couple times, is that initial enrollment period, that 7-month window, and knowing exactly when that window is. Outside of that, if we do delay starting our Medicare, we definitely want to know that whenever our group insurance ends, we have 8 months to make a decision. So you want to know that you do have time, but Medicare needs to be on your mind. And then for people that have started Medicare, we always want to remember the annual election period, where that is October 15th through December 7th, where you can go in and make changes.
Market Medicare Advisors is where you'll find Cory Hiebert, and you can find them online also at marketmedicareadvisors.com. If you've got a question or would like to have Cory's assistance, he'd be more than happy to help you. Rebecca, it flew by.
Yes, it did.
Join us again next week for Health in Retirement, where we will continue to seek out information to provide you with the holistic approach to health and retirement. I'm Rick Everett.
And I'm Rebecca Jones.
And we'll see you next time.
This broadcast is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers and not necessarily those of foundations and its affiliates. The information contained herein does not constitute an offer to sell any securities or represent an express or implied opinion or endorsement of any specific investment opportunity, offering, or issuer. Any discussion of performance or returns is not indicative of future results. Each individual investor situation is different, and any ideas provided may not be appropriate for your particular circumstances. Foundations only transacts business in the states where it is registered or is excluded or exempt from registration requirements. Registration as an investment advisor is not an endorsement of the firm by security regulators and does not mean the advisor has achieved a specific level of skill or ability. Legal services are offered by Eidelman Law Firm. Tax services offered by Market Tax Services. Market Advisory Group does not provide legal or tax advice. Investment advisory services are offered through Foundations Investment Advisors, LLC, an SEC-registered investment advisor.